Welcome, everyone. We'll go ahead and get started because we want to be sure that we're mindful of your time. Got a lot of information to go through today. My name is Ann Panzica, and I'm the Education Outreach Manager. And I'm really excited to present this webinar to you today. We're going to actually be starting out with a story, and this story really goes through what it's going to be like as a provider with a new system and with a new team, provider relations. So this story kind of captures how a provider is able to enroll in the program, what happens during annual renewal, how a provider tracks their attendance, and then we'll go more into detail. So before we begin, I'd like to ask that you please use the chat if you have any questions. We are going to be trying to address every question that comes through. However, our time is limited, so if you do have a question and we don't get to it, rest assured we're going to be reviewing all of them, and we will be providing an FAQ. So, and also be sure to stay tuned through this webinar or go back and review the recording if you're not able to stay for the whole thing, because we are going to be recording it and we are going to go through a lot of information today. So hopefully it will answer all of your questions. So we can go ahead and get started. Next slide, please. Next slide. So we're going to tell a story about Joe, who was a future child care payment system provider. So one day, Joe learned Georgia Childcare and Parent Services program, or CAPS program as we refer to it. He was intrigued by the prospect of reaching even more families and providing quality care. So he decided to become a CAPS provider. Next slide. So Joe was a little bit apprehensive about the paperwork and administrative processes that often come with such programs, and he didn't really know what to expect. So Joe decided to call the provider relations number, and to his surprise, the line was answered by a helpful and courteous provider support consultant named Beth. He was relieved to speak to a real person and get all of the answers to the questions that he had. Beth told Joe that the entire process to become a CAPS provider was automated and that he'd be receiving an email with instructions for applying for the program through the Georgia Child Care Administrative Payment System, also known as Georgia CAPS. To Joe's surprise, the email with instructions was in his inbox the very next day. The Georgia CAPS system was a revolutionary tool that had simplified the entire process of becoming a CAPS provider. And it was automated. So it was so user-friendly and easy to manage that he was able to complete his application, and he could hardly believe his luck. All he had to do was take a picture of the required documents and upload them to the system, and it was as easy as snapping a photo with a smartphone. The system processed the documents swiftly, leaving Joe with more time to focus on what he did best, which is providing exceptional care to the children that he served. After applying, Joe scheduled a new provider orientation. He was pleased to see that there were multiple options available to choose from, even after hours options. He chose the evening session to attend virtually. The orientation was comprehensive, and he learned about the programs that he didn't even know of in all of his years of providing care. So he was excited to have more resources to use in his program and to share with families. He also had handouts and information to help him as a CAPS provider. So next slide. Joe received an approval email, and he was now a CAPS provider. New families were enrolling, and he used the portal to view scholarships, enter attendance, and view remittance statements. Joe always knew how much he was going to be paid, and he knew when he was going to be paid. One day, Joe couldn't find a scholarship for a child in his care. It was after hours, so he tried the submit a ticket feature in the Georgia CAP system. The next day, he received a call from another helpful consultant that assisted him over the phone, and he was able to find the scholarship. The year flew by for Joe, as it does when you care for children. Next slide. And it was now time for him to complete his annual renewal. Joe received a notification, next slide, that he had 60 days to complete his annual renewal. Joe appreciated the reminder, but soon forgot about it because he was very busy with work. Joe received another notification at 45 days and was grateful for the reminder, but the parent walked in and he forgot to put it in his calendar. Then Joe received another notification at 30 days, and Joe decided since he had some time available, which is rare, he would go ahead and complete his annual renewal. Joe was pleased at how quickly he was able to complete it as the entire process was automated. Next slide. And so Joe continued to nurture the young minds in his care, focusing on the families and children that he served. Joe had peace of mind because he knew that he was valued and supported by the provider relations team. Next slide. So that story really kind of takes you through what it will be like for new CAPS providers that are enrolling in the system and enrolling for the CAPS program. And as a former provider myself, I'm really excited because I know how many different things you're juggling as a provider. I know how time is really limited at times. So to be able to make this process simpler for you and easier to navigate is really our goal. So today we're going to be talking about a little bit about the project and the transition. We'll be going over timelines. We'll be going over our brand new portal system, the Georgia CAP system that I discussed earlier. And we'll be talking about how to prepare for the transition as a provider. And also we'll have a question and answer session. So I'd like to hand off to our director, Kay Mayfield, to go ahead and go through the project overview with us.
Thanks, Anne, and welcome everybody. So if this is your first time hearing this, we're glad you're here. We have presented at some different conferences, and hopefully some of you have received our communication. Hopefully everybody has received our communication, but if you didn't, we have this opportunity today for you to go through and introduce you to our team and talk about the transition from Maximus to our CAPS program, our team here at CAPS. So we are slated to transition the work that Maximus has done for the last 22 years. So this is quite an historical event in our lives here. And we're going to transition that work. We're slated to do that November 15th of this year. And so not only have we built a team to support this work, but we're also in the process of building a system. And that system is called the Georgia Childcare Administrative Payment System, or Georgia CAPS. So as we are going to be transitioning the work, and you'll be working in the new system. So right now, you go into the Maximus provider billing application. I believe it's usually called the PBA, provider PBA. And so you will no longer be working in that system when we transition. You'll be working in Georgia CAPS. So to do that, though, we're trying to have the smoothest transition possible. And so our plan is that we are going to migrate all the data and the history from the PBA to Georgia CAPS. So you should see everything in Georgia CAPS, the historical work that you've done, the scholarships, the payments, the remittance statements, all those should carry over into Georgia CAPS. But to prepare for that, you will this Sunday or Monday after October 8th, when you go into the PBA, you're going to see a message, and it's going to tell you that before you can submit your billing next week, that you will need to look at the users that are currently assigned to the PBA and to verify that they still need access. Because what we plan to do is anybody that has a user name set up in the PBA right now who has access to your CAPS information, if you say they can continue to have access to that when we go to Georgia CAPS, we're going to move them over into Georgia CAPS and go ahead and set them up as a user. So you don't have to do any kind of like enrolling people. We're going to carry them over. But it's very important that if you may or may not know, the different users, because really it's up to you to go to Maximus right now and say, I want to deactivate this user. So before we just pull everybody over into the new system, we want to give you the opportunity to look at the users who are currently accessing your information and have the opportunity to deactivate them if they don't need to have a user ID in Georgia CAPS. So after Sunday, this Sunday, when you go into the PBA, you should be getting that message and have the opportunity to deactivate any users. You'll also be asked to fill in some additional information. So if you see the list of users and you only see an email address, then you will be asked to provide the first and last name of that person with the email address, and you will be asked to select their position within the agency. But there'll be a drop down for that for you to select. And one of the options for that drop down will be CAPS program contact. And so this is probably a new concept as far as CAPS is concerned, but we're going to be asking each of you to designate a person within your organization as that CAPS program contact. And that would be the person that we would go to for any questions or, anything that deals with the CAPS. You're kind of leading CAPS for your organization. So you will be asked you will have to pick one of the users as that CAPS program contact. So just get prepared for that before, so that, because it'll be coming next week and you won't be able to bill until you accomplish that. So, make sure you have people's names, their email addresses, and you're able to select a person as a program contact. And so, as I mentioned earlier, we're building this team. And we've got our team in place, and now we're working on building our processes to support you. But our CAPS provider relations is made up of 4 different teams: enrollment services, provider support, quality assurance and payments, and education and outreach. And each of the managers of those teams are here today to introduce themselves and to talk a little bit about their different teams. I'm going to be talking first about the provider support team, because right now we don't have a manager. And so I want to tell you a little bit about that. But that team is going to be, you're going to get to know that team really, really well, because they are there specifically for you, to support you with your calls, with emails, and with being able to, when you in Georgia CAPS, you'll be able to submit an inquiry and they'll receive that inquiry. So they're going to be the person who's going to get your questions, and they're going to try to resolve those questions. They're going to be there to educate you and just basically just be that first point of contact and try to connect you with any resources that you need. And if they can't solve your problem themselves, then they would either pass it off to one of the other teams, or if it's a system issue, they would pass it off to a tier 2 for system issue resolution. So that's basically our provider support team. They're going to be doing some other things, but that's high level. They're there really to help you get your issues resolved. So now I'm going to pass it over to Sarah. She's going to talk about her team.
Sarah Ward. I'm the manager of enrollment services. So our job is going to be to enroll new providers to CAPS. The existing providers, we're going to help them complete the annual renewal process. We'll be doing transfers that relate to change of ownerships, so programs changing hands. And then we're also going to review all of the rate increase requests. So, we're here to help you with any of these issues that you might have along the way. Now we'll pass it off to Alicia.
Good afternoon, everyone. My name is Alicia Golden. I'm the Quality Assurance and Payments Manager. I'm here with our Provider Relations team. I'm not new to Decal, though. I've been with Decal for about 10 and a half years. So just in a different role, but I'm excited about our new team and our unit as well. So a couple of things with Quality Assurance and Payments is that we're going to be reviewing payment requests, payment adjustments, We're also going to be doing some proactive measures that we've created a new quality assurance feature that is going to assist providers in making sure that they have accurate payments. And so we're really excited about some of the new features that have been developed, as well as the tools that are now going to be within your new system, Georgia CAPS. And so we're excited about that. And then our team consists of myself, one coordinator, and then nine consultants. So that's our team, and we'll be ready and waiting once we go live. Thank you.
So again, my name is Ann Panzica, and I am the manager for education and outreach. And I do have a long history as a provider. I was a preschool teacher, a preschool director, and also the site supervisor for a before and after school program and a preschool. And I also was program manager for resource and referral and for a CAPS program in another state. So I do have some experience on both sides, and really excited to be able to be the manager of education and outreach. We have a wonderful team of 5 consultants and 1 coordinator. We're actually currently in the process of getting our 5th, but so a little bit about our team and what we're going to be doing. So we're going to be conducting outreach to providers to promote CAPS participation. That means that we'll be reaching out to providers who have recently received a license and letting them know about the CAPS program. And, as a former CAPS mom myself, I think that it's wonderful to have as many options out there as possible for families to choose from. So, the more providers that we can have in the CAPS program, the more resources, the more options that there are for families. So, that's also something that I'm very passionate about. We're also going to be facilitating provider orientations and ongoing training. So we're going to be capturing what trainings you need as a provider, and we're going to be delivering those trainings to you, as well as the new CAPS provider orientation. And during the new CAPS provider orientation, we're going to be focusing on how to be successful in the program, and then also, how to help families, and then also resources that will support you as a provider. So we really want it to be something that's supportive and useful. And then for support, we're going to be offering technical assistance. So that's something that we'll be delivering to providers on a one-on-one basis, sometimes live if needed, or virtual if that will work, whatever we can do to be able to help. And then we're also going to be developing resource materials for childcare providers. So if there's a particular resource that would help you, or a handout that would really help you as a CAPS provider, that's something else that my team will be working on. So Alicia Golden is now going to go over some of the features of Georgia CAPS with us.
Okay, and right before we get started, we have a short video to share with you about our new system.
At Georgia DeKalb, Childcare and Parent Services, we're empowering Georgia's future. We're committed to empowering our childcare providers. That's why we're excited to introduce the new Georgia Child Care Administrative and Payment System, Georgia CAPS. This user-friendly portal is designed with you in mind, streamlining processes to make your job easier with features like attendance tracking, managing scholarships, enrollment, direct messaging, easy access to resources, real-time payment status, and more. You'll have everything you need at your fingertips to help make your job easier. We're here to support you every step of the way. You can connect directly through the portal. Georgia CAPS is mobile friendly, giving you the freedom to manage your account whenever and wherever it's convenient. By innovating our systems, we're paving the way for a brighter future. From submitting enrollment documents to tracking payments, the portal simplifies your administrative tasks, freeing you up to focus on what you do best, providing high-quality early care and education to Georgia's children and families. The new Georgia CAPS system, designed with child care providers built for success. Log in and explore the benefits today. Visit our website to learn more.
Okay. So just to kind of start off here, just so providers are aware that we are going to be migrating our data from Maximus into our new system, and you're going to be able to enroll through the portal, and you're going to receive an email. So just kind of be on the lookout. As Kay mentioned earlier, this is why it was really important to make sure all of your user access are up to date with Maximus and current, and you remove anybody that you don't want to make sure that they no longer have access, because we are going to be migrating that data into our new system, and that will ensure that you have a smooth transition into Georgia CAP. All right, next slide, please. And then, of course, once you receive that user ID and access, then you'll be able to log in to the portal for the first time with your user ID and password. All right, go to the next slide. And this is basically the provider view. I know it may be a little hard to see in the screenshot, but basically prior to this section that we're under is attendance tracking. You will have a main dashboard that's going to show all those features. You kind of saw some of that in the video, but this particular is showing you how you would be able to select the attendance tracking, and you would see the current status, how long attendances have been in a pending status, not submitted, and also be able to view all of your attendance history. And then, of course, you'll be able to add your attendance. If you go to the next slide, please. And then, of course, it's just going down the left-hand side of the portal view is scholarships. And so you'll be able to drill down into your scholarships. If you'll go to the next slide, please. Here, you're actually going to be able to see all of your current active scholarships, expiring scholarships that will be expiring soon within the next 30 days, recently expired, and then, of course, there is still the hidden scholarship feature. If you have a child that is perhaps maybe out a few weeks and you don't want to inaccurately bill for them, in your attendance tracking, you can hide that scholarship for a temporary basis. Okay, next slide. And a great feature that we are also going to have, in addition to our provider support team, is that you will be able to log a ticket in Georgia CAPS and be able to submit requests based on what your inquiry is. And then our provider support team will be able to triage your inquiries. And then, of course, if further assistance is needed, then one of our teams will be ready to assist you. Okay, next slide. All right. As I mentioned, this is that sidebar that you see in the portal. And you'll see that you have a lot more information that you'll have visible and access to, as well as some unique features that we have done, which is digitizing a lot of our requests, which is a great enhancement in my opinion. So you will be able to submit your request electronically within the system, whether it's a payment inquiry, request, adjustment. You'll be able to see all the documents you've uploaded within the system, your application history, also change requests, such as you need to change your banking information. You need to notify us that a child is no longer enrolled. You need to change your address or update your name. Like, you'll be able to do all of those through this request. And in addition to be able to fully drill down into those features, you'll also have an area within those that you'll be able to actually see the status of those requests. So you'll be able to see if they're still pending, if they've been approved, all of those things you're going to have full visibility to. Okay, next. All right, so before I get to this, I just want to say too, a couple of things that go along with some enhancements that we have made is, you heard me mention that we digitize all of our attendance and payment requests, but a couple of things that really stand out that we heard from a lot from providers, right, is that currently for a service week, you cannot enter that attendance until the end of that service week, so beginning on Sunday, right? But one of the new features that we have done is that you will actually be able to enter attendance on a daily basis. And so you won't have to wait until the week or weekend is over. And you'll actually be able to submit your attendance for that week as early as Friday at 5 o'clock if you don't serve weekend care. And then it will be ready to, if you submit it, then it'll go in the next queue for, of course, processing your payments. But we think that's a great feature. Also, we heard from providers, and currently you have to select every single day if it's Monday through Friday. But we now have a feature that was built in that you can simply check a box. If you know the child was present based on your attendance records Monday through Friday, you can check a box and you will not have to select Monday, Tuesday, Wednesday, Thursday, Friday anymore. Then another new feature is we have a quality assurance feature. You heard me previously mention that QAP, or Quality Assurance and Payments, that's our abbreviated name, will be handling. And basically, it is going to be proactively reviewing payments and ensuring the accuracy of those. And we know that no one wants to have an inaccurate payment, nor we know we don't want them to come out on an audit, right? And so this is a feature that we have created. Hopefully that's going to be a great tool to assist providers and ensure accurate payments. All right. So, yep, thank you. So how to get ready. You've probably received a couple of emails and letters by now, but we want to make sure that with this transition that all providers are up to date and current as possible on your billing. And what we're asking everyone to do is within Maximus, if you can, please make sure that you're billing basically up to date. So as soon as that service week is available, please go ahead and submit that. This will ensure a smooth transition, and it will decrease the delay in payments that you possibly could have. We have communicated that there will be a slight gap in payments as we transition from Maximus to Georgia Caps, but we want to make sure that the payments that you can bill for in Maximus are up to date as possible. This way it reduces the service weeks that may be delayed. Okay, and then you already heard us mention this, but just make sure that you update your user IDs and contacts in Maximus. This again will help us to ensure a seamless transition to the Georgia Cap system that's coming up real soon. And then there's notification that you'll probably see in Maximus if you haven't already. That's letting you know that you must go in and update this information in Maximus to be able to proceed with your access in their system. All right, and I think that was it for me, and I'm going to turn it over to Ann, and she's going to talk to you about training support.
So for training support, we want to make sure that you feel comfortable with this new system. It's very user-friendly and it's very intuitive. But of course, we want to make sure that you're supported. So we're going to have training videos that we're going to be offered. And the training videos will be short videos that will show you how to do a particular task in the system. And those will be released on a platform that we will be announcing soon. And we also are going to be having virtual office hours. So that's after we go live, and a little bit before, we're going to be having some time that we'll open up just to be able to help providers navigate the system, to be able to answer questions in real time, and be able to assist you there. So as far as the level of support, we also are going to be offering technical assistance too, ongoing technical assistance. So if you need some help, education outreach will be there and provider support will be there to be able to assist you with the training and with being able to navigate the system. So this is a quick survey that we're asking that you take, and it just basically tells us whether or not you prefer Microsoft Teams or Zoom, or what platform you prefer for virtual sessions and for trainings and for technical assistance. So if you have your smartphone handy, go ahead and pull it out, and you can go ahead and take that or take that survey so that we can see what platform you prefer. And we can also have this on our webpage as well. And the webpage will be at the end. So you'll be able to get the information regarding that. It's also on the CAP site. So I will go ahead and hand it off to Sarah. I believe Sarah's next to go ahead and go over where to learn more.
So during the transition, for any payment related or enrollment program questions or answers, continue to contact Maximus. If you've contacted Maximus and you still don't have a resolution, you are more than welcome to contact us. We will be happy to help. We also have a web page for firsthand insights, and it's listed right there. It's on the CAPS page under provider relations. And you can also email, please feel free to email us at capsprovidersupport@decal.ga.gov. We will also be communicating the different ways that you can contact us in the upcoming weeks. We'll have more ways for you to be able to get in touch with us, have your answers or your questions answered, and just have some ongoing contact. So be on the lookout for that. And we are definitely here to hear any of your thoughts. If you have any concerns, suggestions, please reach out to us, because we're here to serve you guys and as our providers. So I'm going to push it back over to Ann. She's going to do our question and answer segment.
Yeah, so we've had a lot of questions come in the chat. So one of the questions was whether or not this is going to be recorded. Yes, we will have the session recorded and we will have it available on the webpage. And I did put the webpage in the chat there. So you can go ahead and navigate to it, capture it there, make sure that you take note of that. And like I said, it's also on the CAP site. So just search for provider relations on the CAP site as well. So there was some more other questions too. Let me go ahead and capture or read the ones here in the question and answer. So the system will become available November 15th is when we go live. And another question came out, maybe Alicia, can you help with this one? The question is from Carol, can we do attendance once per month?
So with the system, you'll still be able to wait until the end of the week, or you could wait until the end of the month to submit your attendance. There's no requirement that you must do it daily. It's just an enhancement where you now have access to enter it daily if you would like, and you don't have to wait until the end of the week. However, we do strongly encourage that you stay up to date on submitting your attendance, especially because this will make sure that you've been able to do your reconciliation and make sure all children are accounted for and you have all the scholarships, because then if you identify that something is missing, then you can reach out and have that corrected. When you delay and you wait a full 30 days, then you really start risking the longer that goes, and it can risk being able to receive a payment, because anything greater than 60 days, we do not accept a payment on. And so, or we do not issue a payment on. And so I just want to, try to just really encourage you to try to keep your billing as current as you possibly can, just to be able to reconcile and be able to verify and account for, or even request, right? You have a missing scholarship or anything, that it can get resolved and it doesn't result in potentially a forfeited payment.
So there's another question that came through. Will payments still be weekly or monthly?
Well, with the transition, there will be approximately a 2 to 3 week gap, right? When we first initially transitioned from Maximus to Georgia CAPS. However, DECAL is going to be paying providers a payment that's not associated with your attendance or anything, based on your average previous billing, and they're going to be sending you that payment to kind of help lessen the burden, right, of there being an interruption of payments weekly. But then after that, you still start being back in a regular payment cycle. And so there may be where the week that the cutoff is for payments, then the next week you would start receiving payment. But initially, there's going to be that one-time gap there.
So there's another question about how do we update users in Maximus? And I just want to say that all of the data is going to be migrated over to the Georgia CAP system. So if that's what you're referring to, everything is going to be migrated over. So you don't need to worry about that.
Well,
New
and
CAPS,
and
yes, go ahead.
let me add to that, because
Okay.
one of the things when you log into the provider billing portal this weekend, you're going to get a message, and it's going to ask you, it's going to display a list of users that are assigned to your organization. And it's going to ask you to deactivate anybody who doesn't need a user ID in the PBA or in Georgia CAPS going forward. So when you will have to go through this step next week before you bill for this current week. So you will be asked to review the list. You will be asked to input some information like their first and last name if it's not already associated with their email address. And you will be given the option to deactivate anybody who does not need access going forward. Now, that particular step will not let you add new users who needed to be added. So if you need to add anyone to Maximus, you will need to contact Maximus at their email address or their phone number and ask them to add anybody. So you can add any users by calling or emailing them and letting them know, and they will take care of that. But you will be able to review and deactivate anybody who does not need future access to PBA or to Georgia CAPS. So that should, and then anybody at the point in time that's a current user in the system, after you do that cleanup, they will automatically get a user ID for Georgia CAPS, and they'll get information on how to log into Georgia CAPS. And I want to go ahead and answer another question that was asked about, will organizations with multiple sites be able to log in to see all locations? Yes. What we are doing is anybody under a legal organization, if you have multiple sites under a legal name, so if you are I Love Children LLC, right now, if you have multiple logins for them, when we move into Georgia CAPS, if you had 3 centers under that legal organization, you will see all 3 centers on the login. That does mean that anybody that has a login will be able to see all 3 of your sites. Right now, the way this in our first rollout implementation, we don't have the ability to select a particular site for a user. So any user under I Love Children LLC will see all sites. In a future phase, though, we might be able to designate particular users to particular sites under that legal entity.
Great. So let's see if there's another question. So are parents going to continue to apply on Georgia Gateway for CAPS? Yes, they will still be applying on Georgia Gateway for CAPS. And let me go ahead and go here to the question bank. Like I said, we will be addressing all of these questions and putting them into an FAQ. So if you don't hear your question answered today, don't worry, we will be getting to it, I promise. Will there be a new site to record attendance? So that will be the Georgia CAPS portal site that you'll be recording attendance on. Will our banking information where payments go need to be updated, or does it roll over?
It will roll over. Anything in the system right now will migrate into the new system.
So another user asked, will we be able to deactivate a user, but to add a person to Maximus, we will need to call Maximus? So
yes, you will. So when you log in this weekend or after the 8th, you're going to see a list of users. You'll be able to, you need to verify them and you can deactivate. But in order to add, because Maximus is handling the work right now, and you still need access to the PBA, right? So to add, you'll need to follow their process by contacting them and doing any kind of verification work they may ask you to do to support adding a user for your organization.
Let me go through the questions here. Will we get a new email to log into our new portal?
So on November 15th or prior to that, you will get an email and you will get all the information that's needed to log into Georgia CAPS. We will definitely keep you updated on how to access the new system. But that won't happen. It's not going to happen before, we go live or transition to the new system.
So another question, is there a date when payment will stop for the transition?
Yes. So currently right now with the go live of November 15th, the last time that you'll be able to bill in Maximus will be on November 6th. And then starting on November 15th, then you'll be able to enter your attendance for the week of November 6th. And then of course, the week of November 13th as well.
So another question is, we're a school system and do not work during the summer. What do we do about those weeks?
Was that related to payments? I'm
I
not
think
sure. So if you're a school system and you're not operating in the summer and you don't have any CAP recipients attending because you're not in operation, then you would simply just not, there would not be anything. You wouldn't bill for attendance or anything like that. But of course you would want to stay on top of, if it was time for renewal, you would receive a notification and an email if it was time to renew and things like that. So you would still want to, stay on top of the portal and go in and check things. However, there wouldn't be any payments if you're not operating and have CAPS children attending.
So another participant asked, once you verify your attendance, how soon does payment go out? Are there any changes in receipt of payments?
There would be a slight change because we're doing that quality assurance review of payments. However, it's just a slight change where it's not in the same week and it's going to be the next week. So in a high level example is that if the cutoff for the previous week billing, let's see, let me use this current week. So if the cutoff was on Tuesday, October 3rd for the week of September 25th, then you would not receive that payment this week, which would be technically, today, the 5th, you would receive it the next week. So the week of October 9th. So somewhere around between the 11th and the 14th is when you would receive that payment.
So will payments still be able to be downloaded into an Excel report?
Yes.
So there's a question here about, I'm trying to understand exactly which system she's referring to, but it's, will family service agencies be able to access the portal? I'm not, so if it's Georgia CAPS, probably not.
I think this person may be referring to the community partners in Gateway, possibly, because that's what it sounds like to me. But our portal or our system will not be enrolling enrolling families. The system that we're transferring right now or creating right now is for provider enrollment and provider payments. So not enrolling in families. So two different systems.
So another question here says, I was told you can charge CAPS families for vacation, like the paying families. However, I don't see that in the billing system. Is that true?
So there is such a thing as a holding slot that is within the CAPS policy. And so in order to claim a holding slot, which is typically, let's say that a child typically attends your center, they're enrolled, but they went on a family vacation for a week. If it is in your provider, your location, your center, policies and procedures, and it indicates that you allow holding slots, then you would be eligible to bill for a holding slot and receive a payment. And so this means that the child was not present that week, right? And the maximum time that you can do that is twice per year. So currently with Maximus, they do not have that in their system. If you want to request that, I believe you have to do that by paper submission or by contacting them. But in Future State, it will be in our system, but it is going to have to be in line with your policies and procedures. So if it's not in your policies and procedures, you would not have the option to bill for a holding slot.
So there's another question about, can non-CAP students be integrated into the new system? No, the system is just, the portal system, the Georgia CAP system is just for CAPS families, CAPS students.
But we do have some potential in a phase 2, not in this first phase 1 implementation, but there is some potential to do that. However, a lot of providers use other software to note attendance and things like that. And so we would have to work with you as providers to understand the big picture and all the different scenarios that different providers have to ensure that we do that correctly. But there is the potential to do that, but it won't be in this first implementation. We'd have to have more conversations with you and in order to figure out the best way to make that work.
Another question here is, will transitioning a CAPS child from full-time to before and after be easier in the new system?
I would definitely say yes, because currently what a provider does is they reach out to Maximus. They let Maximus know that there's an issue with this scholarship. And then Maximus has to then turn around and contact our provider relations team. And from there, we have to do that research, potentially make those corrections, and then let Maximus know. Future State, though, we're kind of taking out that third-party entity. And so you, provider, will be able to submit that request within our system, and we can make that correction. Now, ideally, of course, we want the parents to be reporting that in Gateway and contacting their consultant to make changes to scholarships or change provider locations. However, if there is any delay in that or there's an issue with that, then of course you'll be able to send that request to us, because we understand the urgency of you needing to be able to bill and it being on a correct scholarship. There were a couple of questions and several questions about provider rates and family fees. So I wanted to answer a little bit about that if I can. So a couple of things. We all know that October 2nd, right, that providers are now charging the family fee. That is different than the parent's weekly responsibility. So we are kind of in a transition of access, right? When we were fully in access, then DCAL was paying the family fee, parent responsibility, and the provider's published rate, on behalf of the provider and the families. The only thing that has changed is effective 10/2, the families now must pay the provider the family fee portion. Now, if you look on the child's scholarship, you're going to see two different things. One is a family fee and one is a parent's weekly responsibility. You cannot take the parent's weekly responsibility right now. You should only be requesting the family fee from the parent. We are not fully transitioned without access completely. And so the only thing that has changed is just obtaining the family fee from the parent, which may look a little different for your payment starting next week, right? But that's where you're going to get that difference in that family fee from that parent or that family, right? And then provider rates. So we're still in access, and that's been ongoing since 2021, where if you are an existing provider, we have the rates that you had on file, as well as in October 22, DCAL CAPS issued a 7.87% increase to your rates. And we maintain those rates in Gateway, as well as in a portal on the CAP side. Future State, we're going to migrate those rates over into Georgia CAPS, and they're going to be they're going to be housed in there. You'll be able to see those rates as well. But right now, because we're still kind of partially in access, you're not going to be able to increase your provider rates. So whatever you have, including the 7.87%, will be in our system. And then, of course, you've seen letters and notifications, but in January 2024, DeKalb is going to issue another 4.3% increase on top of the current rates that we have. So just want to make sure that everybody's aware of that when it comes to the provider rates. Now, if you believe that you have a rate that is incorrect, then you can reach out to Maximus and they will get in contact with us and we can research that. But if those are the rates that were on file that we had for you, then we cannot change any of the provider rates currently right now.
So there's a question that came in. If you don't have any CAPS children at this time, can you start setting up the new system?
So
yes,
yeah,
you should be able to. Yes.
Okay.
Meaning transfer to the, so if you're actively enrolled in the Maximus system and their PBA as an active provider, then you will transition to the new system and be able to get scholarships if you don't have one now. There were a couple questions I saw, Ann, about the transition payment that we are going to give out to the providers during that, the gap in payment when we transition. And the questions basically asked about, will they have to pay this money back? And the answer to that is no. The transition payment that we're going to give to providers is an extra payment. It's on top of any of the payments that you're going to invoice for. So it's going to be an average of your recent, most recent invoices and the payment that you got from that. So it will not be recouped from you. It is above and beyond. And we want to do that for you because we understand you have these financial obligations. But we also, you also understand that when you transition from one system to a new system, there's going to be some downtime. And in order to help you be able to meet your financial obligations, DeKalb wants to provide this extra payment so that it'll hopefully be able to get you through that period of time. So you will not have to pay that money back. And the other question was, when would they send that? So it is right now slated for the week before Thanksgiving. I think that's the 13th, November 13th. I think that's the beginning of that week, but it's the week before Thanksgiving right now is when it's supposed to be sent. There were some other questions about being able to continue to bill for COVID, and you will continue to be able to bill for COVID. It will be in the new billing system until now that's an emergency policy waiver. It's currently in effect, and until that is no longer in effect, you will be able to bill COVID and will be able to do so in the new system. Also, you asked, will our quality rated bonus be added? Yes, nothing with quality rated. The bonus is not going away. If you're quality rated, you'll get the bonus. Now, the percentages, that it's not going to change. But with these emergency policy waivers, was a higher tier bonus than was before access. So, but that will still be applied when we go into the new system.
So there's a question about, can we bill for federal holidays like Christmas and Thanksgiving if they do for paying families, and also billing for sick days? Were a couple of other questions about billing that came in.
No. So, if you have a full-time scholarship and the child attended Monday and Tuesday, then your attendance record should only reflect Monday and Tuesday. So you're still going to be paid at the full-time rate. If it's before and after or part-time, you should also only enter the attendance for the actual days that the child was present according to that scholarship type. If you enter attendance and a child was not present or in school and you build, for a part-time day or what have you, then it does, it would risk the potential of an overpayment.
Another question, is there a potential in the future to automatically sync with other attendance tracking software, such as Brightwheel or ProCare?
There is some potential in the future, but not in phase 1. Not in our first initial implementation.
Somebody did recently just ask you after I talked about provider rates, about when's a good time that we can change provider rates. So I just want to be clear, reiterate that. So right now, providers cannot change your rates. So the rates that we have in the system include the 7.87% increase, and those rates cannot be changed or adjusted, even if you adjust your rates for your private pay families. We cannot change your CAPS rates currently. This is why CAPS issued the 7.87% increase to help offset that, as well as the 4.3% increase that's coming in January. So just keep in mind, currently you'll not be able to change or update your provider rates for CAPS, but you may change your rates that you have for any private pay children.
There's a question, are family fees different for every family? They are. They're based on an income to family size ratio, so they are going to be different for every family. Let's see, there's so many questions I'm trying to filter through. If any of you see any that you can answer, just go ahead and.
I think there was Alicia, there was a question about the new system shows uploading attendance. Does this mean we are going to start being required to upload attendance for all CAPS children? I think that there's a belief they have to attach a document, but that's not the case. Do you want to talk about that?
Right. So you will still enter your regular submission attendance, on a weekly basis, and then you're going to select what days the child was present for. However, if you have a payment request, and this is a child that maybe there was an issue, or you believe it was an incorrect payment, or a scholarship was missing, and now the scholarship is available, and you've already billed for that service week, and now you want a request for that child. So anytime there's a payment request, then one of those requirements is to include those attendance records. And so that may be where you saw that upload feature at. And so if there's a payment request that is made, then we are requiring the uploaded documents, which is typically support for that request. And it would be, it could be things such as attendance records, yes, but not in your traditional attendance submission.
So there's some questions around when to stop billing in Maximus. It might be good just to kind of reiterate that.
So currently with our go live slated for November 15th, the last day that you will be able to bill in Maximus is going to be on November 6th, and that will be for the week of October 30th. Okay, and so you'll be able to bill all of your weeks up till November 6th. And so, I strongly encourage and urge you to enter that between the 5th and the 6th, because it opens up on the 5th, to go ahead and get current as much as possible. And even, try to get current now if you're not. I strongly encourage that. Because then once that's shut down, our new system will not go live until November 15th. And then you will be able to enter attendance for any prior service weeks that you did not get to bill, as well as the week of November 6th, and then starting with the week of November 13th.
So I think, we're about out of time, but I wanted to address one final question and then we'll move on. And we will, as Ann said, answer all of these questions, but there's some questions about the billing cadence or the payment cadence. So initially when we have that cut over, there's going to be a gap. But when we pick the system back up, and you start billing again, you will receive payment weekly. You will continue to receive your payments every week, but there will be that one-time gap, and then we pick back up, and you will receive payment weekly. So, but all the other questions we'll gather and we will put out in the FAQ. And that was a lot of questions. So, so to wrap us up, that was good. That was good. I like the questions here. So, in conclusion, what we want to do, there were some questions too about why are we changing? And the reason why we are moving over is because we want to optimize your experience when you're working with CAPS. Right now, Maximus has done a fantastic job, but they are a third party and they don't have the intimate knowledge of decal and decal's programs. We feel like within CAPS, within decal, we have that institutional knowledge that we can impart to you. We partner with pre-K and Quality Rated, and all of these, Quality Rated is very, it's a significant part of you being able to participate in CAPS, and they're right here in the office with us, whereas Maximus is not. They're outside and they have to go through us and to get answers for you. But us being right here with all these other programs, that's going to allow us to coordinate the services of our decal programs. And also, we wanted to provide more streamlined system for you. So that's our end goal, is to optimize your experience. And so that's why we are making this change right now. So we're going to be doing that with you. We're going to be partner with you to make this a success. And so we thank you for your participation, and be on the lookout for additional information and updates regarding this transition. I hope everybody has a good day, and we look forward to seeing you next time.
Thank you.
Thank you.